Welcome to our exploration of the stages of wound healing. This guide delves into how the body repairs itself, from initial injury to full tissue restoration, covering both acute and chronic wound healing processes. Wound healing is a complex biological process that restores tissue integrity. It involves a sequence of cellular and molecular events aimed at repair and protection. Acute wounds heal predictably, while chronic wounds may stall due to conditions like diabetes or infection. Wound healing involves 4 overlapping phases: hemostasis, inflammation, proliferation, and remodeling. Each phase is crucial for successful recovery. Hemostasis initiates clotting, inflammation provides immune defense, proliferation forms new tissue, and remodeling matures and strengthens scars. The efficiency of these phases impacts the healing outcome. Hemostasis is the body's immediate response to injury, preventing blood loss. Damaged vessels constrict, and platelets form a temporary plug. The coagulation cascade converts fibrinogen to fibrin, stabilizing the clot. This process, completed in minutes to hours, provides a scaffold for repair cells. The inflammatory phase starts within hours of injury, lasting 2.5 days. Blood vessels dilate, causing redness, heat, and swelling. Neutrophils arrive first to engulf bacteria, followed by macrophages for debris removal and growth factor release. Inflammatory cytokines coordinate healing, recruiting fibroblasts and epithelial cells for repair. During the proliferation phase, the wound undergoes significant rebuilding. Angiogenesis forms new blood vessels, fibroplasia involves fibroblasts creating collagen, and epithelialization sees keratinocytes restoring the skin barrier. These processes collectively close and fill the wound, marking a critical stage in healing. In the remodeling phase, collagen fibers are reorganized, enhancing tensile strength. Type 3 collagen is replaced by Type 1, achieving about 80% of original skin strength. Myofibroblasts contract wound edges, leading to scar formation. Vascular regression occurs, reducing blood vessels and fading the scar from red to white. Acute wounds, such as surgical incisions and burns, heal predictably in healthy individuals. Key features include rapid hemostasis, a controlled inflammatory response, efficient granulation and collagen production, timely reepithelialization, and progressive scar remodeling. This orderly sequence ensures complete tissue restoration within days to weeks. Chronic wounds fail to heal within 3 months, often stalling in the inflammatory phase. Diabetic ulcers result from neuropathy and poor circulation. Venous leg ulcers arise from chronic venous insufficiency. Pressure injuries are due to prolonged mechanical loading, while arterial ulcers stem from reduced arterial perfusion, depriving wounds of oxygen and nutrients. Let's compare acute and chronic wounds. Acute wounds heal in days to weeks with orderly phase progression and controlled inflammation. In contrast, chronic wounds take months to years, often stalling in inflammation with high bacterial load and diminished growth factor activity, leading to incomplete healing and recurrence risk. Wound healing can be impaired by systemic factors like diabetes, malnutrition, age, immunosuppression, and smoking, which affect cellular functions and oxygenation. Local factors such as infection, ischemia, wound desiccation, mechanical stress, and foreign bodies disrupt healing by promoting inflammation and limiting nutrient supply. Understanding wound healing biology is crucial for effective management. Clinicians should assess the healing phase, address systemic conditions, and optimize the wound bed. Regular monitoring and reassessment are vital. Early identification and intervention can prevent acute wounds from becoming chronic.